celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Welcome back to the program. Nice to have you with us on this last Friday night of February. Dr. Lawrence Chan is a co-founder of the Integrative Naturopathic Medical Center, formerly Integrative Healing Arts, down there at 1285 West Broadway in Vancouver. Dr. Chan has been very patient answering all of my questions as all of these boomer issues keep creeping into the conversation, Dr. Larry. But you've been very patient, and we appreciate that. But you've also been telling us about the multiplicity of programs offered at the Integrative Naturopathic Medical Center. One of them that we haven't got to yet that I wanted you to include in the conversation was the Integrative Oncology or Cancer Program. What's going on there?
It's as we get older. I mean, I remember back in grade school, back in the 60s, I guess, early 50s, late 50s, cancer in Canada was 1 in 4 people.
Okay.
And I think the United States at that time declared war on cancer, thinking that we'll have it beat in 20 years' time.
Mm-hmm.
Currently, it's 1 in 3 in Canada.
Oh, my.
And probably within 20 years, it'll be 1 in 2.
Is it mostly lifestyle induced?
We think it is. I mean, genetics have a part of that. It's much smaller than we think, but we think it's lifestyle and environmentally induced.
Okay.
So we always talk about metabolic toxicity, but that's part of the issue for sure. So part of what we do in Integrative Naturopathic Medical Center is that we don't. It's not a this or that with medicine. If a person presents with a cancer diagnosis, and a serious one as well, unfortunately, the statistics will suggest if you take away skin cancers, up to 50% of people with a serious form of cancer will die within a few years. Mm-hmm. It's a very poor statistic, so it's a word that creates a lot of fear in everyone.
Absolutely, you bet.
We like to work on it preventively for sure with everything we've talked about. Integrative Healing Arts or Integrative Naturopathic Medical Center does is for prevention. But if we are faced with a person with cancer at various stages, it could be early or late stage cancer, we're not. It's not a this or it's not medicine or naturopathic. It's both, because we want to take upon a communication with our model to work with the doctor, to work with the patient, to empower them to have the best choices and the best support possible. Mm-hmm. There's 2 parts of that. There's adjunctive naturopathic support, which is if they're working with a medical plan with surgery, chemotherapy, we'll support that and reduce tissue damage and organ damage.
Okay.
So the patient can survive that process and do better and have better vitality through that process. So that's part of reducing toxicity in the patient as well.
All right.
The other one is actually alternative cancer care, is that we can actually provide targets with therapies, with IV therapies and proven clinical therapies that way that can really extend life and to fight cancer directly. So there's 2 approaches we take, and we integrate, of course, specialized diets, specialized intravenous programs, specialized botanical medicines. Many of them are clinically proven now to work very effectively, and specialized nutraceutical products.
Do cancer patients come to you, Dr. Larry, on the basis of a physician referral, or do they generally just find you and look you up?
We get both. Majority of the people come independently.
Okay.
And then we have to then backtrack and work with the physician. Mm-hmm. Some are amenable, some are not so much. Either way, we will get a lot of referrals also from cancer specialists as well.
I wanted to ask you also about another program that you offer that affects one of my teammates here at the radio station, a very athletic teammate of mine, who came to you with a really bad back. And she's very athletic, plays all sorts of sports. And without naming names or whatever, talk to us about pain and pain management and eventual recovery from whatever's causing the pain in the first place.
Absolutely. She the one in this station, she's a very beautiful and athletic young woman. Mm-hmm. And typical overuse injuries and an injury that magnifies over time. She's a runner and does all kinds of cross-training. And she had a pain in her back and her hip that was actually becoming worse and worse over time, affecting her sleep as well. She couldn't even turn over in bed.
Oh, boy.
Chronically.
Mm-hmm.
So we evaluated, we did our structural evaluation, and then we actually did some prolotherapy injections as well, which is a regenerative joint injections, and it really helps rebuild and repair dysfunction in joints.
Okay.
And great success with her, and we get that kind of work all the time.
And so she had hip issues, so you would go right at that hip joint then?
Yeah, and looking at the whole body, foot and everything else, but we look at that as specifically. I've been treating ballet dancers, professional dancers for 25
I
years.
forgot that about. That's right. Our guest has been the physician to the Ballet British Columbia Company for 2 decades or more.
It's been fun. Lots of experience working with them and just seeing what they put their bodies through, because they're fit athletes and they really push their edges.
They are remarkable athletes. We don't give dancers enough credit sometimes when it comes to the athleticism of their calling, and they take a lot of falls. They bend themselves pretty badly sometimes.
Absolutely. We'll see professional athletes, weekend warriors, people that are in different walks but all wanting to do physical activity. Hikers, we'll treat them for injuries, pain, and we've actually gone into more leading edge therapies like platelet-rich plasma injections, which really help regenerate joints, and even looking at stem cell platelet-rich plasma injections as well for the next level of tissue and joint regeneration.
So the idea being, wherever possible, wherever it's practical and smart, manage or deal with pain in a non-pharmaceutical way. And for a lot of us, we're a pill-popping kind of people here. We grew up with, if you got a problem, somebody's got a pill for it. We'll make that connection. Well, it's not always necessarily the right connection, is it?
No, you want to take care of the problem at the source. That's a key thing, and some of it requires more than just a suppressant drug.
Right. Okay, and so pain management can involve diet, certainly exercise, and perhaps even some supplements, which would go into the diet heading, right?
Yeah, supplements would help reduce some of the dysfunction and support the nutrients that are needed to go into repairing the joint and repairing the dysfunction.
Got about 60 seconds for this program. Weight loss. Some people, some people still want to look good in a bathing suit this summer, and there's still time to manage that. Weight loss, what's the drill?
Never too late. Exercise and proper diet is critical for that. Eating the right foods and not just the amount of food is critical for that as well, because not everyone can digest everything equally. So we need to look at what is best suited for that individual. And as your body changes with age, you require different amounts of food and also different types of food. And it also relates to hormones as well.
Yeah, and on a last parting thought, we're Canadians are incredible users of the internet, and we're pretty consistent, and a lot of us are self-diagnosing, sometimes to the annoyance of our doctors. Do you find that? Do you find people? It says right here. I looked it up, Dr. Chan. I've got this because it said so, and I meet all the things that it said on the internet.
I think that makes all the physicians keep us on our toes more. So as long as we have an educated client that comes in, we're happy. So
okay.
Good.
All right, well, a good place to start if you're an internet fan. I'd go to integrative.ca and learn a whole lot more about our guest, Dr. Larry Chan, and his talented colleagues at the Integrative Naturopathic Medical Center at 1285 West Broadway. Good to see you again, Dr. Larry.
I'll see you again. Thank you.
All right. See you next time on Boomer Life.